Hello everyone, welcome back to the PYQ series. In this video PYQ series, I'll be discussing about leptospirosis. This is a very important topic and this video will help you to answer the questions asked on this topic. So without wasting your time, let's start with the video. PYQ number 18, Leptospira. So let's start with MCQ. Identify the disease from the given life cycle. So what are the information provided in the MCQ? We'll see first of all. So how the disease is getting transmitted is through contaminated water and soil, and the risk factor is also mentioned. What are those? Water sports, fishing, swimming, rice farming, contact with animal, hunting, butchering and all. And the carrier if you see is rodent, and the reservoir if you see is mammalian reservoir, which includes wild and domestic animal. And also if you see, it is occurring, the transmission is through urine, and the organism you see it is spiral shaped. So among these four option, if you see, among these four the only spiral shaped is leptospira, and yes it is also the only organism among these four which can be transmitted through rat urine. Okay, so rat urine transmission as spiral shaped bacteria, what it indicates, the disease is leptospirosis, which is caused by leptospira. So we'll see the further discussion about the organism and the disease and its diagnosis. So leptospira is basically is the main two. There are two main species. One is Leptospira interrogans and Leptospira biflexa. Okay, Leptospira interrogans is a pathogenic one, and it has got 26 serogroups, and in this 26 serogroups we have got 260 serotypes, and the basis for this classification of serogroups and serotype is the surface antigen. And among these 260 serotype, the serotype which is actually pathogenic to human via the rat urine is serotype ectohemorrhagia. So ectohemorrhagia serotype occurs via rat urine. So this is the pathogenic one to human, and it is known to cause the severe form of leptospirosis known as Weil's disease. And this Leptospira biflexa is a saprophytic free living, and it is non-pathogenic. Okay, it is non-pathogenic. Okay, now coming to the morphology, as I told you in the discussion of the question, it is thin and coiled, hooked ends and highly motile with two periplasmic flagella. So the flagella are present in the periplasmic space, and it has got hooked ends, as we can see in this image, hooked ends. Okay, and the periplasmic flagella. Okay, here also you can see the cross section. Okay, so hooked ends, spiral shaped, coiled shaped and motile with two periplasmic flagella is characteristic of Leptospira interrogans. Okay, now coming to the epidemiology, it is a zoonotic infection, and zoonotic via almost all the mammalians. Okay, and the reservoir if you see in the question itself is mainly the rodent, and also the wild and domestic animals. And where they actually colonize in the reservoir, they colonize in the urogenital tract, and the serotype, as I told you, ectohemorrhagia, colonizes in the urogenital tract of rat. Okay, and the transmission is through urine of the infected animal, and it may also occur through blood and tissue, okay, of the infected animal. And the certain activities which is involved in transmission of infection is recreational freshwater activities. So the main mode of transmission is water. So water is the main mode of transmission of infection. High risk group, if you see, it is clear now. The high risk group is, the first one is are the vets. Okay, second are the agriculture workers and sewage workers. Okay, so agriculture workers, that those are working in the rice field or cane field, are at high risk of getting the infection. Okay, and how they will get the infection? Route of entry, the route of entry is through cut or abraded skin, usually through foot. Okay, as you can see in this image. Okay, and also the transmission of infection may occur through intact mucous membrane. So non-intact in skin and intact mucous membrane. Mucous membrane need not to be non-intact to get the infection. So we may get the infection either through conjunctiva or through oral mucosa. Okay, remember this. It can occur through intact mucous membrane through conjunctiva or oral mucosa. Okay, so these are the route of entry. Okay, so this is the epidemiology of the infection. Now coming to the clinical feature. So the incubation period is usually 10 days. The range is from 5 to 14 days if you see. Okay, and it is usually biphasic. So it has got two phases. First is the acute septicemic phase and second is the immune phase. The acute phase, if you see in this image, we can see fever, headache in acute phase. Apart from that, we can see the organism is present in the blood and blood culture is usually positive in acute phase. Okay, and it lasts for around 5 to 7 days. Apart from fever, what else we can see? Conjunctival suffusion, jaundice, photophobia, cough, abdominal pain and vomiting, diarrhea, muscle pain, skin rashes, although it is rare. Apart from blood culture, CSF culture may also become positive in the acute phase. Okay, and but the meningeal signs are not prominent. So remember this, although the CSF culture is positive in acute phase, but the meningeal signs are not prominent. So no neck rigidity, no stiffness of neck, no head, no photophobia will be seen because of meningeal involvement in case of acute phase. But though photophobia may be present, but that is not because of the meningeal involvement. Okay, and the muscle pain, if you see, it is mainly in the calf and lower back. So this is the characteristic, this conjunctival suffusion and this muscle pain in calf and lower back is characteristic of acute phase of leptospirosis. In the immune phase, if you see, this immune phase is called because of antibody appearance. So when the antibody appears and the blood culture become negative, so that means disappearance of the leptospira from the blood and CSF and appearance of the antibody. This phase is called as immune phase. Okay, remember this. Antibody appear and the leptospira disappear from the blood and CSF. But though it may be present in almost all other organ and tissue, but not from the blood and the CSF. And urine also culture will become positive. So urine culture become positive, it will be positive present in almost all organ tissue, but it will disappear from the blood and CSF and antibody appears. So this phase is immune phase. Immune phase, if you see, we can see the signs and symptoms of meningitis, which were not prominent in case of acute phase. Lung bleeding, that is pulmonary hemorrhage, we can see. Myocarditis can also be seen, although it is rare. Liver failure, kidney failure, melena, bruises can be seen in the immune phase. Okay, and it lasts for 4 to 30 days. Now coming to the clinical features, apart from these two acute phase, this disease has got two different types. One is mild leptospirosis, one is severe leptospirosis. The mild leptospirosis is also known as anicteric leptospirosis. Okay, and the severe one is also known as icteric leptospirosis. So this is the mild one and this is severe one. Okay. So as I told you, this anecteric is mild or it may be asymptomatic too. And the presentation is usually flu-like illness. Flu-like illness means fever, headache, cough, runny nose can be seen. Abdominal pain, nausea, vomiting can also be seen. Okay, in anecteric phase. And also we can see conjunctival suffusion. What is conjunctival suffusion? I told you two times. It is the redness without any exudate. This is called as conjunctival suffusion. Okay, and we can also see aseptic meningitis during anecteric phase. Okay, and it is more commonly seen in children. Rashes, although it is rare, but it is usually transient in nature and lasts for almost 24 hours only, and it may be macular, maculopapular, papilloscomus, petechial. Okay, and this anecteric phase usually resolve in 7 to 10 days. Okay, now coming to the ecteric phase. This ecteric phase is also known as Weil's disease or Weil's syndrome, and this Weil syndrome is characterized by classical triad of three things. What are those three things? One is hemorrhage, second is jaundice, and third is acute kidney injury. So what will happen in hemorrhage? Hemorrhage, if you see in lung, it will lead to pulmonary hemorrhage, and this pulmonary hemorrhage, if you see characteristically, it is bilateral, patchy with alveolar pattern with affecting predominantly the lower lobe. Okay. Apart from this, the hemorrhage may occur in the gastrointestinal tract and leads to melena, hematemesis. In the urogenital tract, it leads to hematuria, and in the skin, it may lead to petechiae, ecchymosis, or bleeding from the venipuncture site. So this is the characteristic of hemorrhage seen in the Weil's disease. Now the jaundice in this case leads to orange cast to the skin. But one thing important to remember about the jaundice which occur in the Weil's disease, it is that not associated with fulminant hepatic necrosis. So it is not associated with hepatic necrosis. Okay, remember this. And what we can find? We can find in large and tender liver, but no necrosis. Okay. And in acute kidney injury, it may be oligouric or non-oligouric, and it leads to hypokalemia, hyponatremia, loss of magnesium, and hypotension. So these are the characteristic of acute kidney injury seen in case of Weil's disease. Okay. Now coming to the lab diagnosis. Lab diagnosis, if you see, WHO has given a finest criteria for this, and this finest criteria is divided into three types, three part A, part B, and part C. Part A is basically clinical, includes clinical feature. Part B includes the epidemiological factor, and part C is includes laboratory findings. So part A, if you see the clinical features which should include fever, headache, conjunctival suffusion, and jaundice. So these four should be present: fever, headache, conjunctival suffusion, and jaundice. Okay. An epidemiological factor: contact. There should be a history of contact with infected animal or ingestion of contaminated water. And laboratory findings should support by a positive IgM, either by microscopic agglutination test or ELISA. Okay. So this is WHO finest criteria to diagnose the case of leptospirosis. If all these features are present, all these three parts satisfy, then the diagnosis of leptospirosis can be made. Okay. Now, how to do the laboratory diagnosis? Microscopy and culture, and then serology. Microscopy is not very sensitive because of the characteristic structure of the bacteria. However, dark field microscopy may help to visualize the thin coiled, highly motile organism. And this microscopy will be able to find this thin coiled, highly motile organism in the blood during the first week of infection, and in urine after the second week of infection. So after the first week of infection in the blood, the organism will disappear, as I told you, in the biphasic characteristic of the disease. Now coming to the culture. Culture is usually done in EMJH medium. What is that? EMJH, Ellinghausen, McCulloch, Johnson, Harris medium. Okay. And in this medium, we will examine the medium every third day till 2 weeks to declare the culture negative. Serology, there are two type of tests. One is group specific, which can be done by using ELISA. Okay. And one is type specific, which can be done by microscopic agglutination test. Microscopic agglutination test. Okay. Remember this microscopic agglutination test is a test done for diagnosis of leptospirosis. Okay. And this, it is highly specific, and it is usually done in the reference laboratories. And what we will do, we will add the live culture to the patient serum, and we will see for the agglutination. If there is agglutination, it will indicate a positive reaction. Okay. And to say that this microscopic agglutination test is positive, there should be a four-fold rise in the titer of the sample taken during acute phase and the convalescent phase or the immune phase. Okay. So if there is four-fold rise in the titer between the serum of taken during these two phases, so it will be declared as a positive microscopic agglutination test. Okay. Now just a quick review or recap of this topic. So if you see in this graph, the incubation period, as I told you, is around 10 days, maybe 5 to 14 days. Okay, and it has got acute phase or this convalescent stage, which is also known as immune phase. And in this phase, if you see, the fever is present during the acute phase. It may occasionally present during the convalescent phase, and during the resolution phase, you may find uveitis or interstitial nephritis. Leptospira is present in blood only during the first week of infection during the acute phase, and it may also be present in CSF, as I told you. Okay, and in urine it will be present at the end of the first week, and then it may be present intermittently till 6th week of infection. Okay, so in case of reservoir host, it will continue to be present in the urine, whereas in case of the shedders, it may disappear after 4 to 6 weeks. Okay, and the antibody titer will be high only during the second week, and it is usually negative before the second week, that is during the first week. Okay, laboratory investigation, if you do culture, then from the blood the culture will become positive only during the first week, and also for the CSF during the first week and maybe to the second week. But the culture done from the urine will become positive after the second week till the 4 to 6 weeks. Okay, so leptospiremia during the acute phase, leptospiruria during the convalescent phase or immune phase. Okay, so I hope this topic, whatever I told you, will be easy for you to understand, and this video will definitely help you to answer the question from this topic. This is, I believe, is the exhaustive compilation of the content which you need to know to answer all the question from this topic. So don't worry, just go through it and you will be able to answer all the question. All the best.